Of course.
And so often with ADHD, if we're training the brain to be more activated on its own, the person will show signs of being over-medicated. It's like you drank too many cups of coffee, and instead of being alert, you're too alert. And when we see signs of that, I'll tell the person, you know, I really recommend you speak with a physician about this, or I'll speak with the physician and say, this is what we're seeing. What do you want to do?
Well, some of the earlier medications for ADHD, they got a bad rep as the people thought they were, what was the original one that was being used?
Ritalin?
Ritalin.
Yeah.
I mean, they thought the kids were going to walk around in a coma and things like that, and that's not true.
That's not true, no.
Yeah.
No,
yeah.
medication is effective with 75 to 80% of individuals with ADHD, of kids with ADHD. Unfortunately, a large-scale NIMH study has found that after 2 years, the effect tends to fade. And I don't know if it's because people habituate to the medication or people just stop taking it as prescribed or don't follow up. But, and medication doesn't change the way the brain functions. Once you stop the medication, the symptoms are still there.
Right.
With neurofeedback, we seem to be retraining the brain because the effect tends to last.
Does the person, adults obviously, because I'm sure children can't give you this feedback, does an adult know that this neurofeedback is kicking in? Like, in other words, if they feel they're starting to lose focus, then they regain focus or something. Is it that obvious? Is it that, like, you know, black and white, or not? It's much more subtle. I mean, does the person have any, you talked about being in a groove when you play a game. I mean, does the average person understand what's really going on, if they're doing better? Or they just come in a few months later and say, yeah, I think I'm doing better?
That's a good question. Everybody's brain is different. I find the response highly individual. Sometimes people don't even notice they're doing better until I ask them. I always ask people when they come in, how are you doing, how are you sleeping, how are you feeling? And sometimes I ask them, have you reacted or dealt with a situation differently than you had in the past? And somebody will say, oh yeah, you know what? I was sitting at a meeting and this happened and I reacted totally differently. I didn't get agitated or I didn't tune out. And then they realize that they're functioning differently. Some people really feel differently. Some people feel more alert, less fatigued, less irritable. Some people get a report from another family member. You know, you're arguing less, you're less irritable. You're easier to live with. So some people come in and say, I don't notice a difference, but my wife says that I'm easier to live with. And she's been saying that for 2 weeks, and I'll get or a kid will come in and say,
I put my dirty laundry away.
That's right, exactly. Or a kid will come in and say, this isn't helping me. And the parent will call and say, I just spoke to the teacher. He's been paying attention in school for the past 2 weeks and done all his homework. That's never happened before.
Interesting.
So if you get something that's never happened before, or somebody responding in a way to things in the environment that they haven't done before, then that's a pretty good indication that something's changing upstairs.
And how about, you mentioned the sleep. Now, is this for people who can't sleep, or people sleep too much? What is the issue there with neurofeedback? Well,
sleep is one of the primary indicators of how well regulated your brain is. If your brain is well regulated, you're going to be sleeping well. If you're having trouble sleeping, there's some dysregulation of your brain. Almost everybody I train with...
Too many fast waves come breaking through?
Could be too many slow waves. If you have too much slow wave activity, presumably your brain isn't differentiating a lot between a waking state and a sleep state. So making that transition is not easy to do. If you have too much fast wave activity, you're over-agitated, you can't settle down to go to sleep. You have too much slow wave activity, you may be ruminating, you may be worrying a lot. You can't inhibit those thoughts because slow wave activity is a disinhibiting condition. If you think about it, about 80% of what the brain does is inhibit. It tells us not to do things. So for us to have this conversation, we can't be dealing with a problem at the office, we can't be dealing with problems with patients we have, we can't be dealing with things we have to do at home, bills we have to pay, we might be hungry, we might be thirsty, we might be tired. We have to inhibit all that to do this one thing. So that what an activated brain does is inhibits. To go to sleep, you've got to inhibit. And if your brain is making too much slow wave activity, you may have a hard time doing that. Almost everybody I train with neurofeedback ends up sleeping better, even if they don't come in complaining of a sleep disorder. Somehow we're regulating the brain better, and that leads to better sleep. So, I've seen people with sleep disorders come in and work with them specifically on sleep, and I've seen people who I'm working with ADHD or anxiety, depression, learning disabilities, say, you know what, by the way, I'm sleeping better. And they hadn't complained about that in the first place.
Do they dream more with neurofeedback or not? Does that have any relationship to dreaming with that inhibition or not inhibition of their wave activity?
I think everybody dreams. The issue is, do you remember your dreams?
Right.
So everybody does dream. The fact is, if you wake up when you're in the middle of a dream, you'll remember it more. But people who have really disturbing dreams often have less frequent disturbing dreams.
Really?
So people have night terrors or nightmares. That I see decrease
Really?
a fair amount. Yeah.
That's interesting. That's interesting. Have you done anything with smoking or alcoholism or drug dependence, things like that with this at all?
I haven't directly. There's been some good research with alcoholism and drug dependence, though. There are protocols that have been developed to treat that have had good outcome results.
How does it work for, I know that they treat people with high blood pressure with it,
Yeah.
things like that. How does that work?
I think that with high blood pressure, you would probably, I would work with a protocol that would help the person get into a relaxed, calm state, to shift the brain into a relaxed, calm state. That, some people ask if neurofeedback is like meditation.
Right.
And it can be like meditation, except we're actually monitoring the specific brainwave activity. So we know if we're increasing alpha activity, which is more relaxed state. With meditation, if you meditate, you may be or you may not be. But we're monitoring specific brainwave activity. So I would teach the person relaxation techniques. I would train the person person's brainwave activity to relax, and have the person monitor their blood pressure frequently and see if it decreases over time and decreases when they're stressed.
I mean, meditation is probably a form of neurofeedback internally, in a sense, right?
Exactly. Yeah.
Yeah. I mean, I know that when I get anxious, I can kind of call myself to action and say, slow down your heart rate. And,
Right.
relax, and you can feel your heart rate slowing down.
You can breathe slowly. Yeah.
Right.
Yeah.
Right. It's this is an amazing discussion here, because I think that we're just beginning to understand where we can go with this. I mean, and
it's being used a lot with migraine headaches, by the way, too.
Oh, is that right?
Yeah.
How does that work?
By training the brain to be less excitable. The research on migraines has shown that it's a combination of neurological activity and cerebral blood flow. There's a newer technique, which I'm actually going to be trained in November, where we put an infrared monitor on the front of the head to monitor the frontal lobes, and we help the person control the blood flow to the front of the brain. And that's been used in combination with neurofeedback to control migraines.
Interesting. Interesting. Well, I think we need to wrap up.
We're done already. That went fast.
We are done already. Yes, it went very, very quickly. And Ed, I want to thank you for coming in. And once again, if our viewers have questions or concerns, particularly I'm sure parents maybe with children who have ADD or ADHD, Dr. Jacobs is available on his website. I think it's on the screen now, and certainly he's in Londonderry. And
you can email me through the website. You can call me at the office.
Yeah. Yeah, and if anybody calls our office or has questions, people do come in and ask questions to us about our guests, and we'll put a link on our website. So thanks very much for coming in. I know you were here about 10 years ago.
10 years ago, yes.
We've been doing the show a long time. It's been great. Thanks very much.
Thank you.
We enjoy seeing you.
It's been a pleasure.
And thank you for joining us on Eye and Health, and we look forward to seeing you next time. Thank you.